Welcome to the Be Well Now Method podcast. I'm Janet Holtz, creator of Exercising Well, and I am here today with Cynthia Austin. And I'm going to let Cynthia introduce herself, but I am just thrilled to have her here today because most of my clients have some kind of pain or fear of pain. And I have learned so much from Cynthia and all of her posts and her videos about really understanding pain. So I'm excited to dive into the conversation. So welcome, Cynthia. Thank you for being here.
Thank you. Thank you for having me. We were talking before. I think this is a great marriage of talking about chronic pain and exercising. So yes, I'm Cynthia Austin, and I am a national board certified health and wellness coach. That's a fancy title for saying that I help people with lifestyle behavior changes. And I work through a biopsychosocial framework model of helping people change their pain experience. I have three coaching certifications. I'm a life coach, I'm a certified health and wellness coach, and I have the national board. And I do like to shout out for the national board of health and wellness coaching. We are credentialed members of the healthcare framework. So we have set for the board of examiners, medical examiners board. I'm trained in PRT, which is pain reprocessing therapy, and emotional awareness and expression therapy, which deals specifically with the thoughts and emotions. So there's the bio, the psycho, and the social. So that's how my program came about. It came about from my own personal life of living with chronic pain. I lived with pain for almost 50 years, many different types of pain conditions that I had to overcome. So I feel like I have the education that came after I started changing the pain experience, but I have a PhD, I feel like, in living in pain in different age brackets and then in recovering from pain, and also even losing 100 pounds and becoming, so I was completely bedridden and now I'm not bedridden at all. So that's how my program got built, is through my own experience. And then when I went back and I got my board certification, and I specialize in working with people with chronic pain. My program is built on pain neuroscience. It's built from my own experiences of what I had to do. It's also one-on-one learning with some of the pain researchers now. Some of the problem why people don't know what I do and they don't understand the biopsychosocial of treating chronic pain is because the research has been churning out, and it's getting greater and greater and stronger. The problem is this needs to get into the schools, the education,
Uh,
the higher education, then it gets into mainstream medical. And so my hope is that we can make this churn faster. And I think with this podcast, we can get some more words out there about we can change pain. Pain is changeable. That was a shock to me, complete shock. So that's kind of me in a nutshell in my program, what I do and how I do it.
Love it, Cynthia. And I love how you do. You live it. I know that you live it and you teach it so well and you have such compassion for it, but you also have this determination that it can get better because you know it can. So your story is incredible and your program is incredible in your approach. So I'm so excited to dive into that a little bit more and give people a sense for this hopeful conversation about pain, because pain stinks. It stinks to be in pain, whether it's short term or long term. It stinks. So there are ways around it, but the way we think about pain it takes us away from what works sometimes. So I like to start with, along those lines, like to start with that meditation so that we can share this information from a centered place. But also, as you're listening to this, we want you to listen to this from a place that you are trusting what you know inside, to take this information and integrate it with what you know, because that's how this process works. It's how coaching works. And it's really what we know does work for change. So we'll settle into just resting and finding a position where you can rest and close your eyes if that's comfortable. If not, just let your eyes gaze on something and just let your body find a position where it can hold you with ease. Kind of like your bones are holding you, your muscles don't have to work very hard, and it just feels as easy as possible to just be. If there is any place in your body that is experiencing pain, go ahead and move a little bit until you can find a position where you have the least pain possible, or maybe no pain. You might use pillows, you might just adjust how you're sitting or standing, listening to that pain and responding with kindness. And any pain that's left, then Bring your awareness to your breath and your heart and respond with compassion, acknowledging that it's not easy to be in pain. So feel your breath below the level of that. Let that lead you into what you know in your center about what's most important to you right now, about your health, your well being, your ability to enjoy life. Let your awareness extend to any area in your body that is not experiencing pain right now and let it move. Just allowing movement to happen, allowing your body to move. It might be even just a little massage or squeezing and releasing. Anything at all that you can move that feels comfortable to move. And if nothing at all feels okay, then just visualize that you're moving without pain. Let your body come back to stillness, come back into your breath and your center, and notice that there's wisdom in your body, in your heart. And hold that, keep that awareness in your center as you gently open your eyes. Cynthia, where would be the most logical place to start? If you're just starting to talk to somebody about pain, what would you want them to know first?
The first thing I tell them is that the International Association of the Study for Pain says that pain is a sensory and an emotional experience. And most people do not know that. That's usually how I lead out is, has anybody ever talked to you about what pain is? And I have never had anybody say yes. So first you got to understand that it's sensory. That's physical. Yes, you've got to address the physical. That's the bio piece, the biomedical model. You've got to address that, but you've got to address the emotional too. So first, let's talk about the pain, the physical side of pain. We have sensory receptors in our skin, right? And the skin those receptors, sends messages from the environment. Everything's coming in through all our senses into our environment. It goes through nerve fibers, which is part of the nervous system, up into the spinal cord. These are messages, not danger messages, not pain messages. They are just simply messages. And then they get registered in the spinal column and they're just registered. Hey, we got a message. We need to take care of this message. What does this message say? So once it's registered, this message goes up into the brain and the brain perceives. These words are important. Registered is different than perception. So these messages get perceived. What is the determining factor on how they're perceived? It's based on threat and survival. It's based on the survival mechanism inside our brain. So with that, okay, that's the physical side of it. That's what's going on. So why is pain also an emotional experience? And it's because it's based in the survival mechanism. And it all goes together. When you have pain, you have a very strong emotion. It would be very rare to not have a strong emotion about the pain. So then that gets wired very deeply inside the brain, in the amygdala, and says, do not touch that hot stove again. It's a learning. So we also have to look at pain. It's a harm alarm, but it's a teaching signal
Mm,
also. So we have to completely look at pain differently. It's a signal, a teaching signal, and a harm alarm, a danger alarm. The way I tell people is this is where we're supposed to live, in this danger alarm, the harm alarm. And as things happen, traumas, life experiences, crap just keeps piling up. If we are doing anything to lower it, it's just going to get up to 10 and we're going to feel severe anxiety, severe pain. Then it moves into depression, and then eventually it moves into complete. And then there's actually a graph for this too. There it moves into complete overwhelm. So you've got to stay within your window of tolerance to do this. I don't know. Does that make sense?
it
That
does
that
make
this is
sense.
deeply wired as an
Yeah.
emotional event also.
Yeah.
And so the bio model, which is generally what is going on in the mainstream medical system now, they're only looking at that piece, the bio model. If you're the other thing I tell my clients is if that's all they're treating is the bio, you're only getting 1/3 of the medicine. It's bio. You've got to look at the physical and you've got to look at the psycho, which is the psychological, and you've got to look at the social, which is the social aspect, which is our relationships. That was the first research I read. The very first research I read said that social situations could increase pain. the feelings that I was experiencing in my life, that's when I went, what? We can do something about this. We can
Right.
change this if we
Yeah.
change our thoughts, if we change the relationships, if we add boundaries. It's amazing.
How
But yes, this
empowering.
is, yes,
Yeah.
and that's what my clients get from this,
Yeah.
from the education.
Right.
And again, I will say again, education alone we know is not good enough. But when you give them this education, and then you say, guess what? I've got 17, 18 different types of free tools that I can teach you to change this emotional part, this emotional side. And again, I'm not a therapist and I'm not a doctor, so I don't treat or diagnose. I work with lifestyle behaviors, and that's everything about what we need to do to change the psychological and the social. If someone is having, the trauma issues or mental health diagnosis, then I will help them get to where they need to be. I make sure I stay in my scope of practice. That's where I work. And
Right.
it's helping them take what we all know we need
Yeah.
to do.
Yeah.
It's a matter of doing it and getting it to where we get that cycle. So we've got to change the pain cycle. This is the way the pain cycle is running. And what we do is to try to back it up and then lay a new pathway over here, if that
Yes.
makes sense.
It makes sense. And I think so many things pulled out. One I want to just say is I think when you talked about the learning piece, what I encounter most in my clients, because when I talk about exercise, the first thing that they think of is no pain, no gain. I have to push through pain. That narrative is so wired, especially if they did sports. And that's usually our first introduction to being active as kids is sports. And so if you have that narrative of no pain, no gain, and it's also reinforced in our fitness culture a lot of times. And so I have to say, I talk to every client about that. It just comes up in every conversation when I talk to patients and clients about exercising. They just assume they have to push through pain. So, can you talk more about that learning piece and maybe childhood experience and messages and cultural messages that have piled on this challenge with pain?
Well, that just that one phrase, no pain, no gain, that won't work in pain recovery. It just won't. Because if you are hating what you're doing and it's painful, you will get no benefit out of it.
Mhm.
Very, very little benefit because your brain's going to fight you the whole time. It's not going to stop. It's the thoughts are there. There's so much about this
Yeah.
that I want to say that it won't all come
I
out.
know.
It's just like, first you've got the thoughts.
Mm,
I'm not good enough because I can't do what mainstream exercise people are saying. So first you got that thought in the back of your head.
shame.
And then you go, I'm going to do this. I'm going to do this. And then you push through and you do it. And then your body screams at you. Why did you do that? This hurts. You knew this was going to hurt. Why? I'm never going to do this again. So that fear gets deeper and deeper wired.
Mm,
So naturally, that harm alarm starts going, or the danger, because this is danger alarm. But the problem is that people don't understand is this danger, it's not a real tiger. And that's how our bodies are responding and our brain is responding. Our nervous system is responding as if it's a real tiger. I'm not trying to negate the problem or the issue,
yeah.
but if we can pull some of the fear out, some of the
Yeah.
some of the
Yeah.
self-hatred out
Yeah.
of I'm not good enough because I can't do what they're telling me to do. So when doctors or anybody in the medical community tells people go home and they're 300 pounds, go home and do 2 miles, go walk 2 miles. That's where you need to start. They're setting them up for pure failure.
Not only failure, but integrating it more, right? Reinforcing that whole pain cycle.
Yes.
Yeah.
Yes.
Yeah.
Yes. Because then the thoughts, which
Yeah.
lead us to emotions, which lead us
Uh-huh.
to behaviors.
Yeah.
So it's an awful cycle. And
Yes.
that got wired into my pain cycle.
Mhm.
And and it was back in the 80s. I'm really dating myself here. I hurt myself at the job, in a pharmacy job, and I fell. And they sent me to back school. They told me, don't bend. I
That'll work.
stopped bending
Oh my
because these
gosh.
people that I trusted told me
Right.
not to bend. And so I'm trying to find other ways to bend. I'm squatting, I'm doing all this other stuff. I had to relearn bending was safe. Literally, I had to relearn that because that's the thought, which leads into an emotion. Oh my gosh, if I bend, I'm going to damage myself more,
Right.
which led to a behavior which I stopped bending.
Yeah.
To
Amazing. Right.
overcome the back pain, I
Yeah.
had to
Yeah. So this is really like a big ball of like just tangled yarn. And I find the same thing when I'm working with patients and clients. It's like a big ball of tangled yarn. Like they just say, I'm just lazy. I'm not exercising. I'm just lazy. And I know there's so much underneath that. And so it sounds like what you do too is kind of, let's just loosen that a little bit. Let's get underneath that. Let's see what's really going on here. What's the emotions? What's the thoughts? What's the physical pain? And create some space there so that you can start rewiring those things that are just one's leading to the other and tangling everything up. Yeah.
yes. That's where we start is we have to start bringing, like if we say I'm a self-awareness expert because that's what I do with very powerful questions with the coaching. That's what I do is I draw it out of them where they're at in this moment. What can they do? And then if it's really small, we have to work within the maybe some shame issues about feeling like, well, that's all I can do, or the
Mm,
all or nothing, like you were talking about. You've got to go out there and do 30 minutes of exercise routine to start with, or a 2 mile. Yeah, that's the messages that we're getting. But the message that I give them is stop looking outside of yourself for your answers. That person over there that started with 2 miles, that's their journey. Your journey's different. Bring it in. This is when I do say bring it in
yeah.
and
Yeah.
start listening to your own body at where you can start. If all you can do is sit in a chair and lift your arms,
Hmm.
if that's all you can do, and if it's only 2 times each because you've got neck problems, then that's where we start. If it's only one time because you're in that much pain, that's where we start. I used to use the phrase, I don't really say it much anymore, start stupid small and do not care what anybody else thinks about where you're starting. It's the acceptance. That's the only acceptance that I bring people to. It's not about accepting the pain or accepting where you're at and you're going to live there the rest of your life. It's about accepting this is where I am and this is where I need to start the process of changing the pain experience. You have to bring it down so small. You have to stop caring what anybody else thinks about what you're doing. Friends and family may not understand. You may have to start explaining the pain neuroscience about why you're doing things differently, and why you're changing things. You mentioned a minute ago the ACE scores, the adverse childhood events.
Mm, yeah.
A lot of my clients have really high ACE scores. Their adverse childhood events have a huge factor in chronic illness, not just pain.
Can you list what those are for people who don't know what the scores are?
The ACE score, the adverse childhood events are different traumatic experiences that overwhelm the nervous system when you're a child.
Yeah.
There's things like did any parent become in prison, go to prison?
Mm,
Did you witness any physical assaults? Did you witness verbal assaults? Things of those kind of things. Were you abused? Were you sexually abused? Just, I think it's 10,
mm. Okay.
is 10 of them.
Yeah.
And so that can be a good indicator that you may be dealing, and you can find those anywhere online, just find the questions. So it's not like some special test that you only get through the medical community. You can find this online and figure out, wow, I do have a high ACE score. Maybe there is an emotional component to my
Yeah.
pain,
Yeah.
which I think there is an emotional component to all pain,
Hmm.
and it needs to be addressed, or
Yes.
it will start wiring together
Hmm.
and become chronic, persistent pain if you don't
Yes.
deal with it in the
Yeah.
beginning with the
Yeah.
emotion.
That's a huge piece, that difference between acute pain and chronic pain that I like to share with patients because by the time I see them, they're in chronic pain, usually when they've gained a bunch of weight and it just becomes so integrated and they're so wired and I help them kind of rewire that through movement. But I'm curious, how Can you explain that difference between acute and chronic pain and how acute pain tends to lead to chronic pain? Like, what are the factors that lead to chronic
Well,
pain?
pain is kind of like what everybody knows, like if you break an arm or if you have surgery, things
Hmm.
like that. I mean, that can cause acute pain. And this is the healing process. It's very different than persistent pain. We know that the acute pain, it's firing in those centers, in the pain centers. But when it moves over into persistent pain, it starts moving where it fires. And we know that it's starting to fire in the emotional centers. So that's why the International Association of Study of Pain
Yeah.
says it's a sensory and an emotional event when we get into the persistent pain. But acute pain is the healing process. It's doing all its magic in there. And it doesn't feel good because it's doing all its magic, and it's trying to protect you with the inflammation and the blood flow, and all that. So it's working, it's doing
Mm.
its job. The thing to do when you're in acute pain, because some of my clients have come back to me going, I broke my ankle, what do I do? So we work within that about staying focused of what's going on in your life and being
Mhm.
very mindful that you're keeping your nervous system in a calm state, that you're doing the deep breathing, that you're doing all the tools that you know to work to bring that pain level down yourself, reducing the stress, which everybody
Mhm.
says that reduce stress, reduce stress. So
Yeah.
that's what the whole program's about.
Yeah.
It's about
Yeah.
reducing stress.
Yeah.
So that's what you got to do for acute pain. Well, for persistent pain, you still have to look at both. But sometimes when it's developed into chronic persistent and it's been years or longer, it's a matter of looking at the emotional. So you've got to start, and then it's become the predictive coding is a factor into it, which is like when you ride a bicycle, that's predictive coding. When you learn, when you jump on the first time and you fall off, you've got to get back up and you learn. That's predictive coding. Your brain learned it. So generally, I might be able to get on a bicycle today and go for a ride. I hope I could. We'll see. But that's predictive coding, right? I should be able to get back on there and ride, even if it's been
Right.
a while.
Right.
So predictive coding, it gets better and better and better at predicting what's going to happen. So with pain, if you bend, or if a doctor has told you don't bend, you're going to be, that predictive coding goes, okay, if I bend, I'm going to produce pain. The brain starts predicting that it needs to produce pain with the bending movement. So that's something also that I had to unlearn. It was the fear of moving, of bending, and retrain the brain through the pain reprocessing therapy that there was no danger at bending. I was safe, completely safe. I was not injuring my back. I didn't do anything to harm it. Bending is a safe motion. And that's something that Howard Schubner, he teaches also is, the bending is a safe movement, and any other movement are safe. We're not damaging ourselves if we go for a walk to the mailbox. We're not. It's all predictive coding
Right.
saying if I walk to the mailbox, I'm going to produce pain because of that one time that it did. Does that make sense at
It
all?
makes total sense. And when you talk about acute pain, I think acute pain, not even just that injury, but if I walk to the mailbox and I have pain with that, listening to that pain is not, so it's like, even chronic pain, you have acute pain, that's pain in that moment, and how you treat that moment of pain. It sounds like what you're saying. What you do in that moment of pain is either wiring the same predictive, I'm going to have pain, I can't do this, I have bad knees, I have a bad back, and rewiring that, or you're rewiring a whole new way for your brain to say, oh, that's safe. I don't have to send a pain signal. Yeah. So
Yes.
we've got the bio and what you said, like pushing through pain, that can cause inflammation, and that's going to cause that biologic pain at the pain site. But then if you pair that with, and I have bad knees and I just have to push through pain to lose weight and I'm never going to be this and all of that, those thoughts, one's working against the other. And so it sounds like that mindfulness, that in that moment presence
Yes.
is really important.
Yeah, the emotional must be addressed, and that's the thoughts. I start out with the ants. I call them ants. They're automatic
Mm.
negative thoughts. We've got to get the ants out of the picnic. You're not having fun
I love that.
because it's amazing how people do not realize they have become their own bully.
Yeah.
It's amazing to me. You
Oh
you
my
don't
gosh.
hear this? You don't hear this? But yeah, they become their own bully. So we've got these thoughts that carry us deep into these emotions, which create behaviors of stopping movement. So what you got to do is you got to restore balance with yourself. And this is bringing the mind and body back together. One thing I want to say and make sure everybody understands is I'm not saying you should not have these strong emotions. You
Mm,
need to experience them. You need to feel them. You need to be with them. What I'm saying here is they're not helping you. They're a normal human reaction to the pain, to the stress, to life events. But we all need to stop and say, is this carrying me to safety, which means your nervous system is in a safe zone, or is this response carrying me into the harm alarm, the danger alarm, all of that side of the nervous system? Are these thoughts helping me or are they hindering me? And so these strong emotions, they drive pain is, sorry, these strong emotions of like fear and anger, they're like gasoline for pain, pure gasoline. So if maybe people can start noticing when their pain starts to go, what just happened? Was I angry 30 minutes before? Was I angry yesterday and I woke up in extreme pain this morning? Start bringing that self-awareness to what's happening in your life emotionally and mentally, socially, environmentally, in every way to see if you can start finding the triggers. And that's the first step. It's the self-awareness of these strong emotions, these thoughts, these strong emotions that are driving your behaviors. Three things that will keep you locked in pain: worry, self-criticism, and pressure to achieve. There's characteristic attributes for people with pain. We are a very conscientious group of people. Very generally, what I'm saying is very general, but we're very conscious. So we worry. We put a lot of pressure on ourselves. We're perfectionists. We bully ourselves. We have become our own bully, especially if we've had high ACE scores, the adverse childhood events.
yeah,
I know that you've become your own bully if you've done no work. You've become your own bully and it's playing into the pain factor. Like I said, these are normal human reactions, but they're not helping you. So sit with them with that tender side of self-compassion and sit with it, but then pull up that fierce side of self-compassion and do something about it and start changing it. Yeah, we're trying to create a corrective experience. And that takes all these different interventions that you figure out is your pain-free formula. Every single person has a different formula. There's no one on this earth that has the same formula as you or me or any of
mm,
my clients. Everybody has a different formula, and you've got to figure out what it is. And that's what I do as a board certified health and wellness coach. I help pull this out of them. And then this is what we try to do is we find coverage over you with a corrective experience. That helps with the road waves. When
it's
you get
that.
hit with a road wave that you're not, because we can't stop stress and we
Yeah.
cannot stop what other people are doing in our lives. So if you've got your container of safety around you and you get hit with a rogue wave, hopefully you're just going to do this. Okay. Maybe you lose a tool or two and you have to shore back up. But that's
Mm,
the process. You're going to get hit with rogue waves in life. We can't stop that. And you may lose these two tools next time
mhm,
and your pain comes back in.
yeah,
But you got to shore up these tools again and get that coverage. That's your container of safety that you've got to build. And that's what I help people build. People come to me with these dog-eared books of John Sarno or Howard Schupner. I've read this 3 or 4 times, but I can't get it implemented. So that's what I do. And that's what pain coaches do. We implement, help pull it out of them, what they want to do. Then they've got the buy-in of what they're trying to do. And then they go out there and I say, we're doing experiments. There is no pass or fail. It's an experiment. Do the best you can. If it goes badly, come back and we will say, that didn't go as planned. What do I do now? What do I do differently to make it go better? And that's what I teach people is this process of filtering up the bubbles of pain, the bubbles of the emotions that are fueling the pain. And as those bubbles, we refine the process and it gets better and better and better at covering you and changing your pain experience. This is not, I'm going to go do yoga and get
Yeah.
out of pain,
Right.
or I'm going to go deep breathe and get out of pain. This won't cover you.
Right.
It won't. So and you've got to figure out what works for you. So that's kind of what I think needs to happen for people with chronic pain. And then through the program that I do, it's an individualized program. Like I said, I help you find that pain-free formula. The way we do that is first thing we do is examine what you experienced. What is your pain experience? And that's something that people have never, they always like, I've never seen my pain experience from this view before. So we do that first. And then part two is we learn all of these different techniques about changing the pain experience. By the end, 17 or 18 different tools, strategies, skills
Yeah.
that are free,
Yeah.
completely free. And so that's how we create the mind body interventions that change the pain experience. Again, it takes more than just one thing. It takes a lot. It's a complex, complex problem.
That's such a great visual. I love that. And for people who are listening, Cynthia's putting her hands together like a shelter and that protection. So just that alone tells the brain, I'm safe. I'm safe, where pain says you're not safe. And so I love how you do that, but it is individualized. That there's just so much here. There's so much to learn about pain. I think it's so fascinating, but I love how like it's mental, it's your self-talk, and I'm just kind of reiterating what you said, but what I heard you say is it's self-talk. It's paying attention to what your thoughts are, paying attention to what your emotions are with that. And it's paying attention to the actual physical pain and what's going on. What are you doing to, what might be making that worse? Like we talked about, like bending incorrectly, learning the correct way to hip hinge so that you're bending in a way that's not straining it. So it's all three of those. It's mental, it's physical, it's emotional, it's even spiritual. It's even what's important to me about this. And that social piece is huge. Is there anything else that you would want people to know about pain to maybe change the narrative about it?
I think a big takeaway would be for people. I've got 5 practical tips that I could share too.
Okay.
But I think people need to stop focusing, and this is going to sound crazy, stop focusing on getting rid of the pain because that's actually adding urgency and fear. So stop trying to get rid of the pain. Focus on what can I do today, and maybe even just one small repetition of practicing, but it's slowly building one thing. Maybe it's deep breathing. Um, and you practice that one skill until you get it to where it's a habit. And then you pick up the next thing. So stop trying to get out of pain and start trying to build skills. And I have 5 tips about doing that, about how to get started with movement for people with chronic pain. The first thing I would say is visualize movement before you ever start. You can close your eyes and just visualize, kind of like what we did with the meditation. It's the same thing, and you can do it with your own words. You don't need to go find a meditation. You can just do your own visualization, see yourself. And why this is important and why this works is that it helps the brain create positive expectation. It reduces the fear even before you start moving. So that's why the visualization is a great way to start. I had somebody that I worked with, she had vertigo, really bad.
Yeah.
And it was a nightmare for her to try to exercise. And so we pulled it so far back to that she would just literally lay on the floor and visualize. And she's in the beginning, I will say she got dizzy even just
Yeah.
visualizing. And she said, this is so hard, even just doing this. So we slowly worked it up to the next step, which is start small and build up gradually. Instead of pushing yourself, the no pain, no gain mentality, start with small, low risk movements and do it in a comfortable environment. If you're not comfortable in a gym, don't go try that environment because it's not gonna go well. So make sure you're in a comfortable environment. So maybe start by just, if you're, if you're not comfortable walking down the road, you can walk inside your house. You can walk outside your house. You can find other ways to do these things, but start small and build up gradually. Recognize the fear of movement, acknowledge, yes,
Yeah.
I'm afraid, but let's not let it control you. So we just need to acknowledge that this is the brain's way of trying to protect you from, previously it wired it very deep emotionally. Don't do that. That hurts. So we've got to remember that the brain is just protecting you, and it doesn't always mean danger. So we've got to acknowledge it, and then we just slowly take steps forward at our own pace, not the no pain, no gain. The other thing that I found very important was that I needed to tell myself personally that all movement is safe. That was something I had to learn, because I had learned that movement terrified me when I had migraines. When I started migraines when I was
Yeah.
7.
Yeah.
So I learned to paralyze myself in the bed,
Right.
because so I was trying to control the pain that way. So in my late 40s and 50s, I had to learn that all movement is safe. I had to relearn that. And I guess, yeah, the next two, one of them is celebrate every win, no matter how small. Those small wins add up. And then again, that's working within the brain to set the expectation, the positive expectation, and you're retraining your brain with a whole new neural pathway when you do this. This is helping with those thoughts and emotions and behaviors. The last thing I would say is make it enjoyable. Pair it with something that you love. I absolutely love music, dancing. Can't dance, not a professional dancer or anything like that, but I love to dance. And
Me
if you
too.
can't get up and dance, you can chair dance.
Chair dance.
I'm showing it.
Yep,
You can chair
exactly.
dance. You can. And if all you can do literally is a little bit yesterday I was so proud of myself. I did some Taibo. If anybody
Oh,
remembers
fun.
that.
Yes,
Again, I'm
yes,
dating myself.
yes,
But
yeah. It's good stuff though.
I did Taibo way, 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 way back
Yeah.
before the back pain kicked in. But yesterday I was like, I can do this again. I can do this again. So every day, even for me, there's new explorations that I find that I forgot I could
Yeah.
do that. And I have on my bulletin board over here, the neural pathways are there. I just need to wake them up. And for me, that's what I had to do. I had to wake up all those neural pathways of things, knowing how to exercise. I had to learn that again. So that's a big thing. There's a lot of big takeaways, but the big thing, stop focusing on getting rid of the pain. Yes, that's the ultimate goal, but the way you're going to do that is through daily, consistent, repetitive micro steps. And that's what they hear constantly in my program is repetition and micro steps all the way to the end. The other thing I say, if you don't stop, you will get there. And they hate that one, but it's because it is kind of stupid,
Yeah,
right?
right.
But if
It's
you
true.
sit down and say, I can't do any of this, then you're going to be stuck there. And I don't want anybody to be stuck there. That's why I do this work. I suffered for 50 years, and there's a way out of pain. And I found it. There's a way out of losing 100 pounds. And I found it. There's a way out of getting your body and enjoying life. And I found it. I found the answers in research when I started doing advocacy work. And it's led me from 2009, 2010 to this day, um, to doing what I love doing, which is helping people figure out their pain experience so that they can start making changes. And
Mm,
then we slowly stop. It's not like therapy. I teach them the process, and then we stop seeing each other as close together. And then eventually they know the process. It's their process. And that's the beauty of it. I'm not telling them what to do. They're building their own lasting pain control.
yeah, that was so beautifully said, and you could tell that you just live it, and you know this in your bones. You know this, and I think like before we started recording, you were talking about building that bridge between the medical professionals and the patient, and that coaches are that bridge. And I love that analogy. It's so true. We all know going to see a doctor and you have 15 minutes and you're trying to get all the information you can. And then in between that next visit, a lot can happen. And it's really hard to put those things into action. And this is really what coaches do. And the coaching process that really is standardized now by the national board, that there's a standard for coaches. Not anyone can call themselves a health coach, but there's an
Yes.
actual science and process to this. And that's why we're glad we have the national board certification to say, no, coaching is really something. It's like if we said, oh yeah, you could be a doctor, go ahead, go be a doctor and just go tell
Yeah.
anyone anything you want and use any process you want. This is a really tested process. And then we were also talking about the specialties that we have, that health coaches have limitation with what they can actually do. But when you combine health coaching with another specialty like pain or like clinical exercise physiology, you get very rich information in a way that you can hear it. And that's, I think what you're saying is that this is not just here's how to manage pain. I'm going to tell you, it's a conversation and it's a step-by-step approach. So that bridge between the medical provider and the patient, the coach helps you put those things into place. And so thank you so much for what you do, because it's such a need. Pain is such a problem in our culture, and it has such downstream problems like weight, like medications, like depression, like relationship issues. When you're in pain, nothing else matters and you don't have the bandwidth. And so it has such
Yeah.
downstream effects. So I'm sure you see that with your clients, the upstream effects of reducing pain in this very whole person way. And I love that. I love that you take the stress out of applying what we know about pain.
Yeah, I think bridging the gap is really important. And that's something that I've put out there. It's really important that people start understanding pain in a new way and how it's produced. It's produced by the brain 100% of the time, regardless of what's going on. It's produced by the brain 100% of the time, based on everything it knows about you. And I don't know if I mentioned this, but something else is a threat to yourself. And the reason why can be produced, a threat is registered a threat in the body regardless of whether the threat is to your physical life, like a broken arm or a cut finger, or your physical body, your physical life, is your sense of self,
Mm,
your belief system,
yeah.
your self-esteem, your feelings, and also your race. There is research that's showing that race has a factor of how you're feeling about your race. It's amazing.
Yeah.
It's an emotional, there's a lot of emotional and social aspects to pain. And like you said, I'm trying to bridge the gap by
Hmm.
getting information to pain professionals saying, look, we've got to do this differently. I think it was back in the 1500s, and we are still, or 1400s, we're still managing pain based on that century. And it's not working.
Yeah.
It's not working. We got to do something different. We must give these people something different because they're suffering needlessly.
Yes. Yeah. Well, thank you for providing a way out for people, really, Cynthia. And it's a process, but it sounds like what an enriching way to use pain as a guide to whole person health, to really understanding yourself better and your body and your everything better. And so thank you so much for what you do.
Thank you. I appreciate it. I love what I do. It's so much fun to help people find answers.
Excellent. Thank you. Well, I would love to have you back and we can maybe take a deeper dive on some of these other big topics that you cover. So thank you again for being here. And yeah, and I look forward to next time.
Yes, and thank you. I've enjoyed it very much too. Thank you so much.